Okay, ma'am. A very good morning and warm welcome to one and all present here. It gives me immense pleasure to be a part of this webinar on the birth anniversary of Swami Vivekananda, which is also observed as the National Youth Day in India. Today's topic of discussion is emotional well-being of youth for us, by us. And I think no other day is best suited than this to address and talk about ourselves and our friends. Before that, I want to welcome our chief guest, Dr. Sanjay Garg, for his presence. Dr. Garg is a renowned psychiatrist by profession and head of Department of Psychiatry at Fortis Hospital, Kolkata. He is also an avid teacher campaigning for mental health awareness through media, workshops, and school liaisons. We welcome you to this webinar, sir.
Thank you. My pleasure.
Thank you, sir. Now, let me start with my topic, which is mental health from students' perspective. So today's topic for my presentation is mental well-being or emotional well-being from students. So what do we get the first thing in our mind when we think about mental health? We think that it's a person who is working and is very distressed from his work and is not being mentally stable. But do we know that even students like us, like me, even I am a teenager and even I feel that mental pressure is even for us. Even we feel that mentally we are ill or we are not happy. Nor can we say we are sad, but we are not happy. We are very pressurized from our school work, and especially now we are doing online classes. We are very pressurized. And being at the age where curiosity level and learning power is the highest, we pressurize our minds a lot that I want to learn this, and that, and we join all the classes. But at the end of the day, we have taken all the knowledge we wanted. But with that, we even take some positive thoughts and negative thoughts. So that negative elements, if we start feeling a lot, like we think a lot about it, it makes us feel more negative, lonely, and we feel that we are not up to the mark. Are we doing good? Are we just touching the mark which is responsible, which is, set for us? Can we move to the next slide, ma'am? Yeah, we feel a lot of pressure, depression, anxiety, fear, and stress. We feel that our marks are slipping, our grades are slipping, we are not going, when you're mentally ill, you even feel that my stomach is hurting, I'm scared of nothing, but just I'm scared. The pressure which comes, it comes with some physical effect too. We have headache, we feel very tired, though we are not working that much, but we feel very tired. We feel that we are overwhelmed, we want to cry. It happens because of too much work, but even not because of that. We are finding it hard to focus, and we start feeling that we are not compatible with everyone else in the race. Now this picture which is in front of us shows our mental state right at the moment. It feels that the whole world is stuck within our minds and it's tangling us and we are not feeling well. And COVID, classes, family, studies, it's all just pressurizing us so much that we are not getting the point of happiness, that with what can we be happy? This slide shows the most integral part of our school, our friends. So in the left side, you can see that this is our older self, that we played with our friends. Now also we are meeting our friends, but in an online mode. Now we don't get that small jerk that, okay, when we were in the classes, we got that even on small moments which occurred, we can just laugh. In the online classes, we can't, because we are bound into a device. Everyone is muted and we can't just get those moments on which we can laugh. Everyone is muted, no one is speaking. We are just focusing on class. When our teacher asks, we unmute, answer, and then we stop. But when we were in school, we were like, okay, something just happened, someone answered, and we all start laughing. So that was a bit happiness which we can't get in online class. But then again, when there is something negative, there is something positive. I would like to thank my school so much that my school is taking some steps to make our online classes as funful as the offline ones, because we have parties and celebrations on almost all the occasions, and in that we all stay unmuted and enjoy a lot. So I would like to thank my school for that. And now finally, I'd like to end and speak to everyone that you should take care of yourself. Mental illness is not something you should be scared of. Students, and even I'm a student, I feel very nice that when I just take out 10 minutes for myself, just alone, I'm listening to music, dancing, and doing whatever I want. So now I think that these are not the only challenges we face. Let us hear more about more challenges we face in mental illness by Rishabh.
Thank you very much, Aditi. Good morning, everyone. I would like to speak along with the PPT. So, Shreya ma'am, can you just present the PPT I've made? So far, we have talked about what emotional well-being is and what it means in teenagers. But now we will be talking about some challenges that are faced by students, especially during this pandemic. Ma'am, can we move on to the next slide? The next slide, please. Thank you very much, ma'am. In this slide, we can see the different challenges faced by students. There are some common challenges here like stress, panic, body shaming, and anxiety. But I wanted to delve deeper into this by talking about a personal challenge that I have faced. In 2021, I was diagnosed with a life-threatening syndrome called MISC. I spent 6 months on medication, and after spending 1 month in the hospital, it had taken a toll on me. I found myself getting angry, getting frustrated, and becoming spiteful and mad at my parents. I was frustrated by everything around me. I tried talking to my parents, but since they had seen me in that state in the hospital, they used to ask me again and again whether I was fine or not, which used to make me very frustrated, and I just did not like talking to them anymore. The thing that helped me cope during this time was an app called Discord. Discord is a social platform with which you communicate with your friends. And talking to me was the best medicine. I could talk to my friends, I could share my thoughts, and I could lessen my burdens. Another thing that helped me during this pandemic was sitting and thinking about my choices and the consequences of these choices. What if what I had chosen was the right choice or not? Because of this, I started to think about my parents, try to understand their point of view, try to understand their part of the scenario. And I found myself talking to them again. I think talking is the thing that has helped me the most during this time. And as a fellow teenager and a student, I have a few tips for my friends. I think talking is the best medicine for everything. Lessening your burdens and sharing those burdens with the people you care about is the best medicine. That's all, and I would like to move over to Shreya. Thank you very much.
Good afternoon, sir, and to all my respected teachers and friends. As I'm continuing with the challenges faced by teenagers these days, I would like to add my own experience as well. When back in the offline class times, I would get body shamed a lot, and that really lessened a lot of my confidence and everything. I had this fear of getting judged or like embarrassing myself. So I just this fear actually developed into social anxiety, and I actually avoided any kind of social events, gatherings. I avoided going to school and even like those workshops where children used to speak. I used to feel really nauseous and everything. I used to get isolated in my rooms. But in these online times, when I got a lot of time, I engaged myself in dance, and that really helped me to overcome my social anxiety. I actually got really confident, and now I feel I am really comfortable around cameras and people, and I don't feel any kind of nauseous feeling when I socialize. So I think I feel happy with who I am right now, and I actually am starting to love myself. I would like to give some tips for those teenagers who also relate to the same problem. I would like you all to at least spend 5 minutes to appreciate yourself, the beautiful you, who you are, and let all the voices out of your head, and don't compare yourself with others, because that would make you all depressed. I would also like you to do what you like, and I think that would help you to overcome all those problems that you are facing. Thank you. I would like to pass on to Vice Principal Ma'am.
Thank you, Shreya. So before I make a comment on Shreya has said, let me talk about what Rishabh mentioned, a very important and pertinent point. He mentioned that we should not stop talking, which means the communication channels at all levels should be open always. At times, Rishabh, as you said, that when your parents asked you, you felt frustrated, you did not feel good. But however, if you think, on behalf of the parents, they did their bit. They kept on, they kept the communication channels open. But we also have to keep in mind that we cannot be overbearing. We have to give some concept of time and space to the person whom we are trying to help out. And as Shreya mentioned, that they have all the first three speakers have put their challenges, their personal challenges, whatever they had to speak about their friends, absolutely in a very, very organized way. And let me repeat that all three of them have spoken right from their heart. And I'm sure Dr. Garg will address all these things at the later part of after the other three speakers have done their bit. But before we move on to the next part of our session today, we have a very small video on about our school, because Dr. Garg, definitely we would have felt much better if we had these kind of sessions offline, but then this is the only option. And we would also want you to know about our school of BDM International. So we have this small video. I would request Vikram sir to play it. Thank you, Vikram sir. And Dr. Garg, I'm sure you've just got the tip of the iceberg of what we call BDMI. It was just a glimpse of everything. And I would thank all the in charges and the teachers who put in together to make this short video. At least, Dr. Garg, you had the feel of what BDMI is all about. So we could move on to the next speaker. Shreya ma'am, please take over.
Now let us all continue with the topic. I would like to draw attention towards the challenges which the students face and also juxtapose it with the present COVID situation. As we can see it in the first image, various people are satirizing a boy because of his obesity and fatness. Even many young boys and girls are also subjected to body shaming due to their physical appearance. Students lose their self control, self belief, and self confidence because of the criticism which they face, and this leads to various emotional and mental problems. They undergo physical changes like changes in their behavior, confidence, and require counseling in order to regain their confidence and conviction. This has increased heavily during the present COVID times because as many children are sitting in their homes and are not able to avail to the proper exercises are gaining weight. The students who are not able to handle or take the criticism in a sporting manner are being affected by depression, stress, and other various mental problems. So, the second picture depicts the helplessness of a student who is not able to overcome and cope up with their stress and has fallen as a patient of mental and emotional problem. This also causes a hindrance in the student's personal life and academic life. Mental unhealthiness reflects its effect on the behavior and attitude of a teenager and a juvenile, ultimately reducing his concentration level, consistency, and a creativity present inside the brains of a child. As in this COVID situation, children are not able to discuss and interact with their friends, which ultimately reduces their morale. The present COVID scenario has showed a deep impact on the students' mental life and health. However, the students are able to interact with each other during the discussion of various projects which our school is initiating. The students also feel isolated and alone during this pandemic, due to which they have been affected by various serious mental problems. So I would like Vedika Didi to continue.
Thank you, Shaunak. So, good morning to our respected chief guest, Dr. Garg, and everyone present here. I'm Vedika from class 11, here to speak about my experience with So, 2019 was the year when I went through a lot of changes, starting from eating disorders to environmental shift as I was introduced to gemstone after 5 years of milestone. So I started to have anxiety and I ignored my hunger or maybe wasn't feeling hungry at that time. And it affected my mental and emotional well-being and also affected the way I tackled other parts of my life like studies, relationships, etc. But the 2020 pandemic uh, gave me some time to sit and think about myself and my health. I started working out and having healthy food, started talking to myself, started gaining a little bit more weight, which actually made me feel good. Also, I started to track my feelings and habits. I started collecting small things wherever I went. So that helped me a lot. It made me love myself and appreciate a lot of things that I have around myself. I just do not want my fellow teenagers to feel that they're alone in this journey. More or less, we all go through our share of obstacles. Just do not stop pausing. Just do not, stop, hustling. And we all need to just stop for a while and realize all the good stuff that is present around us. I think that will really help. Thank you.
Our next speaker is Moon.
Well, as we could all hear from the responses that we got from this session, and I would like to add my perspective to it. That is, we all got a mixed reaction, right? Many of them had shared the bad experience during the pandemic situation, and many of them have also, acknowledged the good things that they all have practiced, especially the habits. I would say they actually adopted the habits, and I would also add my experiences to it too. That previously, in my previous class, when this online session was all happening, I was really very scared of just speaking or turning on the mic. But afterwards, when this my class finished off and I was been promoted to the next session, that is my 11th class, I gave a thought that I have to change. because this, we don't actually know, that there is no certainty that when this pandemic would end, or when will this end actually. So I adapted myself that no, now it's the time for the confidence to show up. So now I talk with teachers, I talk with my fellow friends. Now I am very much interactive, I would say. So specifically, I would also like to give this suggestion to all the speakers who told that instead of just looking into the negative sides, we should always acknowledge the positive sides. And in the negative side, try to find the positive side. For example, if you are getting bored with the online session, okay, try to connect with your teachers. Try to say at the end, of course, of the end of the class, try to say a joke, or try to, have a 5 minute at least interaction with your friends. And I am definitely sure that this would recover. Or, positivity is a very good and essential impact we get from our life, and we can extract it from our life. Positive impacts have a definite feature of making our minds very clear about certain things. So I would like to keep this concluding part in a positive note. That is, let us all be together. Let us all concentrate on the things that are happening good, or let us contribute to this society. Let us make people happy, or let us help people when they are in need, in actual need, in dire need of this pandemic, especially whatever the problems they are having. We can, from our part, maybe we are not professionals, but we can, from our part, at least try to solve that. We can actually try. So last thing that I would like to say, that I really dream of one day we will be again coming back to the schools with a smiling face. I can see my juniors and seniors again coming with a smiling face, with lively spirit, and we can expect good things around us again. So I would like to present some artwork which I did, a few drawings actually. So I can expect this to happen. That is, students again sitting in the bench, and teachers are actually teaching us. This is actually the very missed thing now, that we miss. And secondly, children are again playing in the playgrounds. In our school, there is a huge playground, and I could see in the offline sessions that many used to play basketball or kho, kabaddi, and etc. So this is actually the second missed thing. And the third, whatever we had in the cultural events that added the spirit in our school, this we can expect, that people can again participate in the annual fest, or people can participate in the sports. So let's end this conversation. Let's end this session, or let's end with the talk of the speakers with a little positive note and a special quote that I had written specially. Stay positive. Better days are on their way. Thank you so much for patiently listening, and have a nice and beautiful day ahead.
Thank you, Moon. Definitely, we are looking forward to the brighter things, and the brighter things will immediately crop up. One fine morning, we wake up. I know it won't be any magic, but however, we have to think positive. And what Moon, Shaunak, and Vedika has said. So what I understand from what they have tried to put it together is we need to understand the relationship with our own selves and think beyond ourselves, reach out to others, be with each other, and try be of help and do a hand holding with one another. So with that, I'm sure all my 6 speakers, they have tried to put in their self thoughts and their thoughts that their peers might want to put it forward. Now, before we move on to the next part of the session, which the Shreya ma'am will be moderating, the question answer session, we will have some questions being put forward for Dr. Garg. I would request Principal ma'am to say a few words, ma'am.
Thank you very much. Am I audible?
Yes, you are.
Yeah. Good morning, everybody. This is you can hear from my voice that I'm suffering from terrible throat condition. I was depressed since morning. That today is such a bright day. The first program which I will be witnessing with the students of BDM International School, and I couldn't go to school. Anything that is, a little different from whatever we expect or whatever we aim at is makes us sad, makes us feel that the world has fallen apart. So that was my feeling in the morning when I understood that I'm not going to be able to be present physically in the school today. But nevertheless, when I joined this session, I was so much relieved to hear all of you speak and to understand that the future of the nation are in the hands of the youth who can take care of themselves, at least by understanding their constraints and trying to find a solution from among themselves. We are organizing this program commemorating the National Youth Day. And when we are thinking of the youth, and when we are thinking of strengthening our youth, we must start by strengthening the minds, because that is where everything begins. I am extremely happy to hear all our speakers that they are confident enough to know that what they are going through, what are the disturbances, and also to suggest remedies like talking among friends and coming up boldly with the constraints and moving ahead. I'm extremely thankful to Dr. Sanjay Garg, who has taken his time out. Sir is extremely busy. But believe you me, the moment I picked up the phone and requested Sir, sorry, to join us for today's program, he never hesitated even for once. And he agreed to be there with all of us. So thank you so very much, sir. We are indebted to you. We would love to have you over to school once all our students are there and address them face to face. But we are making the best use of technology at the present time. And perhaps that is why I could join today's session also from home. So I'm thankful indeed to everyone. And I just want to say one last thing. Maybe there are pandemics, maybe there are lockdowns, but there are no locks to put our spirits down. We are always going to be high spirited and happy and healthy in our minds and bodies. Thank you so very much.
Thank you, ma'am. Now, Shreya, ma'am, if we could go ahead with the next part of the session.
Yes, ma'am. Thank you. Thank you, Principal, ma'am. Vedika will be speaking about, will be introducing Dr. Garg. Vedika, over to you.
Though Dr. Garg needs no introduction, but still as a part of the program.
Ma'am, should I continue?
Okay. Yes, please, Vedika.
Okay. Now, with the permission of my respected teachers, I would like to introduce our respected chief guest, Dr. Sanjay Garg. He is renowned. He is a renowned senior consultant psychiatrist with extensive experience in mental health and behavioral disorders. Dr. Garg has contributed significantly in research to ascertain the epidemiology of psychiatric disorders. Dr. Garg has got wide exposure in the management of illness, mental illness problem, behavior, suicidality, epilepsy, genetic syndromes, and associated mental and physical health problems, ADHD and autistic spectrum disorders in urban and rural population. Dr. Garg's psychological therapies with experience. Dr. Garg's psychotherapy experience, aware of various models of psychological therapies with experience of explaining, initiating, and completing individual and group therapies using a variety of models. So I would like our respected chief guest, Dr. Garg, to speak a few words.
Thank you, Vedika, for that kind introduction. And of course, a big thank you to BDMI for inviting me here today. My grateful thanks to our principal, Madhumita ma'am, who in spite of her illness has joined us and contributed as much as she can. And my thanks to our vice principal as well, again, Madhumita ma'am, whom I talked with yesterday. So it is my pleasure and privilege to be here today. And I'm really honored, and I was very glad to listen to the young minds, especially the young speakers. It is a very overwhelming moment for me because unfortunately, whether we like it or not, mental health remains very stigmatized, and it is always shoved under the carpet, and often people are very reluctant to talk about it. So my hats off to our young speakers, Aditi, Rishabh, Shreya, Shaunak, Vedika, and Moon, who took this opportunity to speak out and voice their thoughts and the difficulties that they had gone through. It's not an easy task. I really understand that. And it is really a courageous act from their behalf that they have managed to do so in front of everybody. So again, I appreciate them. Uh, Mental health has always been something which people have been reluctant to speak about, though believe me, it's more of a pandemic than the COVID that we are seeing currently. We have seen a huge amount of people, especially after this pandemic, coming to us, seeing us with various sorts of mental illness, whether it be ADHD, whether it be autism, whether it be depression, post-traumatic stress disorder, anxiety, etc. And we are seeing more and more young people coming to us, talking more openly about their mental health issues than their elderly counterparts. I see a 5-year-old and a 90-year-old all coming with various mental health issues. And unfortunately, often I find that they approach us quite late when things have already taken a severe turn. And unfortunately, we do end up seeing people who at times have crossed boundaries and tried to sort of attempt suicide, etc. as well. I am really glad that on this Youth Day, BDMI has taken this initiative and speaking about mental health, because this is something which we need to talk about. The more we talk about it, the less stigma we will have, and more openly people will be able to sort of voice their issues. Believe me, it is something which is treatable, which is changeable, and people can lead a fit and healthy life. Mental health is extremely important because not only it sort of influences what we're doing today, but it also influences what we're going to do tomorrow. It decides who we are, what we think, how we perceive situations, and how we can sort of maintain a relationships, which is an integral part of living a human life. I will be there. I am glad if people want to ask me any questions, because I think this would be a right opportunity to give the students a chance to talk to me, interact with me, and ask me anything that they have in mind. I would just like to end with a quote from Swami Vivekananda saying that the world is ready to give up its secrets if we only know how to knock, how to give it the necessary blow. So if you are ready to speak out, if you are ready to seek help, we are there to provide help and get you back on track to live a healthy life. Thank you very much for inviting me here today.
Thank you, sir. It is really assuring to hear from you when we hear that it's a topic which, mental health is an area which is still has a lot of stigma around it. But if we have such webinars where the young minds, they are, putting forward their thoughts and feelings, and especially if we have someone like you guiding us, I think we'll be able to, see better days ahead. Thank you so much again, sir, for being a part of today's webinar. Students, I would ask you to put forward your questions in the chat box. Sir is here. He will, I think this is a very good opportunity for us to, address some of the concerns that we all are experiencing. So you can write your questions in the chat box. students?
I hope they are able to write because Vikram sir had disabled them from writing.
Yes, ma'am.
There's one question, I think, already. No?
No.
So before the students come up with a question, sir, I have a question for you.
Of course, ma'am.
Because, I have been in education, I have been in school, and we are educators here. We also act as counselors because from time to time, we need to talk to the students and give them assurance from our end. But what I find is when we are back at home with our children at home, we are not able to, play that role of a counselor. So why do you think that this change in the, a dual self in ours, or what could be a solution for that?
Ma'am, that's not an easy answer. I face the same thing at home myself. वो जो घर हिंदी में बोलते हैं ना, घर की मुर्गी दाल बराबर. So it's almost like that. I think a lot of it is due to the fact that when you are in school, there is sort of a hierarchy, there is sort of an expectation, and the students are looking forward to you as an idol, and they believe in what you say, and they have that trust factor in you, which makes it much easier for you to sort of influence those young minds and be able to do that counseling part and play that professional role. Unfortunately, at home, we are often taken for granted by us children, and unfortunately, being the young minds they are, no offense to the young minds, but they're much more susceptible, but they're much more sort of easily able to take things from either their peers or from people outside the home. So that is something which is very common. It's mostly because you are there available 24/7 to your children that it becomes much more difficult to sort of play a counseling role to them.
This is what, even the parents.
Adding to,
yes,
sorry,
please,
sorry, Vivek. Yeah, I just adding to that, sir. Actually, I think I'm in a similar situation that VP ma'am is in. Now, what we find is that our children, we find it difficult to reach out to them, but despite all our best intentions, I mean, our students accept us far more openly, and we are able to make a difference, which even our children acknowledge. In fact, I see my daughter who tells me that I reach out to my students very well, whereas she thinks I'm an extremely unempathetic mom, one who doesn't understand the situation. So this is where we realize it's really a conflict, because we are trying our level best to do what is right, because definitely as mothers, we want to reach out to our children, but then is it just the third voice? Then that is all that is important. I mean, taking us for granted is, I understand, but I'm not saying they don't even acknowledge what we are doing. They acknowledge that we are doing good in our respective professions. We are reaching out to people at large. We are making a difference. Absolutely fine. Yes. But the fact that we are not reaching out to them, that is very loud and clear. That is where we are genuinely troubled, sir.
No, you see, this is why I brought this up, because we met a couple of parents, Rakhi ma'am, if you remember, and this is exactly what they have said, that ma'am, we have been doing this in our school. Some of them are teachers, some of them are lawyers, they are established. We've been trying to do this, and because during this 2 years of pandemic, the children are at home, so the parents had to give a support anyways, but they could do no help. And some of them, they came to us, we spoke to them, and even Shreya ma'am spoke to them. So that is why I brought this up. I think with this, we have a couple of questions for you, sir. If Shreya ma'am,
yes, ma'am, I'll take them. So Rishabh has this question for you, sir. Is there any advice that you would like to give the teenagers and students who are facing mental challenges during this pandemic, sir?
That's a good question. And in fact, that's one of the questions that I hear day in and day out from the young people who I interact with. Dealing with mental health issues is similar to investing in a relationship or your financial planning or your future. So you have to take some time out and invest for your mental health. Basically, it may sound cliche, but there are things which you need to do on a regular basis. So one of the things that is very important, especially when you're having these online classes and in this pandemic when you're at home, is to have a routine. often I find that people lose the routine. So they're not eating on time, they're not sleeping on time, they're just getting up just before the classes and rushing and joining the school. So they have to maintain that routine. So that's very important, that you're having your meals at regular intervals and you're sleeping at regular intervals. Then the third important point is having some sort of physical activity. Again, due to the pandemic, the things are limited, but you have to have regular physical exercise, because not only it helps in your physical fitness, but it also helps in your mental fitness, because there are some positive chemicals which are released, which we call endorphins, which help us to feel mentally well. Other than that, what you can do is connect with people. That's again very important. And I really like the fact what Rishabh mentioned, that he had used Discord to connect to people. So unfortunately, in this pandemic, they're using the term social distancing, which we as mental health professionals do not like. It should be physical distancing, not social distancing. So you need to be still in connect with people. You need to reach out, because we are human beings. We cannot live as islands. We need to be able to connect with each other. So that's the other important point. Then having some sort of activities and interests out with your normal curriculum is also very important. I often hear that as a child, we would do that. As a student, initially, we would do that when we were young, like drawing, painting, etc. But that's also equally more important in these current times, because we do know, we in fact use art therapy, music therapy, drama therapy, etc. to bring out your emotions, to help you cope with them. And I really like the drawings that she presented, that it is a good way out to sort of deal with your emotional health. So if you do these sort of things, that is bound to help you. What we also recommend is what we call journaling. So if you are going through difficult times, write down your thoughts. It helps to bring down your emotions, to look into and put some good things which you have experienced during the day, read them aloud to yourself, and that will give you a lot of positive vibe.
Thank you, sir. I think those will be really, it's not only for the teenagers, but I think for all of us, it will be really helpful if we follow them. The next question, sir, we have for you is how to, accept criticism, because many a times we see teenagers, they, they have difficulty in accepting criticism, and that often affects their confidence level, and it leads to other anxiety and stress. So could you please throw some light upon that, sir?
Sure. So again, criticism should not be taken on a personal level. It's almost like looking at a glass, whether it's half full or half empty. If someone says it's half full, he's correct. If someone says it's half empty, they are also correct. So you need to approach criticism with an open mind, looking at the positive aspects of things and not taking it personally. Criticism is in fact an opportunity to improve yourself. See, nobody in this world is perfect. If I say that I am perfect, I don't make mistakes, I'll be telling a lie. We all have our strengths and weaknesses. So we need to focus on our strengths. We need to be at the same time able to understand our weaknesses, pick them up from the positive criticism, and use it as an opportunity to improve ourselves. So there's nothing wrong about having some sort of criticism. There's nothing to be ashamed about. In fact, it's a learning opportunity. If we fail, if we have successes all the time, we will not realize the importance of failure. Failure is also a learning opportunity. So we need to use these criticisms to change ourselves, to mold ourselves, to identify our weaknesses and move on from there.
Thank you, sir. So another very key concern nowadays, because we are spending a lot of time in the virtual space, we as teenagers and also as caregivers, I think, meant to set those boundaries, how much to spend, how much time to spend on the device, and how to bring certain limitations. Many a times we see that teenagers have problem. They spend a lot of time managing time. Spending a lot of time in the using the cell phones or other devices, and they are unable to maintain that boundary. So, sir, how can the teenagers try and work upon that?
Again, that's a very good question. This is an issue which we are facing regularly in terms of people having problems in terms of controlling the amount of time they spend online. Initially, before the pandemic, our recommendation was 2 hours of screen time a day. But we do know that that's not practically possible in this current scenario, because everything is online, whether it be education, whether it be connecting to friends, whether it be recreation. So everything is online, and we understand that it's not practically possible to do that. But at the same time, we need to realize, as our principal ma'am said, technology is good as long as you use it in a positive way. So you have to put your boundaries yourself. You need to understand that there are various means to sort of spend time offline as well. So often we recommend families that there should be some control over the time you spend on the gadgets. So try to engage yourself in other activities, like, for example, as I mentioned, drawing, painting, listening to music, reading books, etc. The paper books, not the online again. So doing these sort of things, trying to have activities out with the gadgets, out with your sort of the time that you spend online really helps. I often recommend parents to involve the children in household activities, household chores that they are doing. Often people are working from home, so asking the children to sort of contribute to what the parents are working, that also goes a long way. So they have to work as a family together, often having a meal together. So doing these sort of things, and again, parents are role models, so they also have a very big, huge role to play. So if we are spending as parents most of our time online, we are picking up our phone when we are eating, so they also do that. So we have to be careful as parents as well, the amount of time that we are spending online. So it's a balance between all of these, and if we do that, we can achieve that.
Thank you, sir. I think we will take 3 to 4 more questions. I just happen to look into this question. Let me read it out. It's from Triporna Mitra. I would like to ask that at times there are some thoughts in our minds which, in spite of trying a number of times to put away, tends to return back and our mental peace gets ruined. Then what shall we do at those times?
Yeah, well, unfortunately, we do find in some illnesses like obsessive compulsive disorders, where you have these thoughts which come to your mind on a repeated basis, cause a lot of anxiety, cause a lot of stress, and you find that you're unable to get rid of them. That's a very common phenomena in some mental health illnesses. And this can also happen when you're anxious, when you're distressed, etc. The important part to remember is what we call having analysis of these thoughts. So first of all, it's good to write those thoughts down and then try to analyze it in what we call ABC: antecedent, behavior, and the consequences. So what you need to understand is where these thoughts are coming from. What are these events that are triggering these thoughts? What is these things which are making these thoughts come? Then try to analyze what the thought is playing as a role and what are the consequences of these thoughts. So once you are able to analyze these sort of things, you can use those sort of to avoid those triggering events, so these thoughts do not come to your mind, number one. Number two, unfortunately, in spite of avoiding these triggers, if you still have these thoughts, then you can use various distraction techniques which we can sort of help you cope. So suppose you're having this negative thought about yourself, you can listen to music, you can sort of distract yourself, read a book, you can talk to somebody about these thoughts. So it will help you get distracted from these thoughts, and gradually you will be able to cut down on these thoughts. Sometimes using a simple technique which we call a rubber band technique also helps. So you put a rubber band on your wrist when you're having these thoughts, just bring the rubber band a bit and then leave it away. So that pinching of the rubber band can help you sort of distract from these thoughts. So there are various ways which you can use to distract yourself. You can think about the pleasant memories that you have, pleasant vacations that you've been out to, the pleasant moments that you've spent in school. So using these sort of distraction techniques, you can reduce these thoughts.
Thank you, sir. There's another question from Oishi Gupta. She wants to know, sir, that teenagers are often feeling lonely and are not able to open up to their family and closed ones. They're not able to talk to our old friends and even new one. So how to avoid this loneliness and try to lighten up their lives?
Well said. Again, this is a big issue which we are facing amongst teenagers. And in fact, that's what our vice principal ma'am mentioned, that the parents are not being able to connect with the students or their own children, while at the same time they're able to connect with the students. So that's something which we often find, that teenagers come and tell us that they're not being able to connect to the parents or open up with their siblings. And often I find that they do not have anybody that they can voice their problems to. That's where the role of the teachers, the school counselors come into play. They can open up, they can connect with elders that they feel that they are comfortable about talking. So you can talk to your school teacher, you can talk to your counselor, you can talk to other elderly people whom you feel confident enough to talk to. There are a number of helplines which provide anonymous support. So these are things which you can use to sort of get support. Later on, if required, I can provide the number of the helpline that Fortis runs on a 24/7 basis. And we can sort of provide anonymous support without you divulging your name or where you're calling from. And these are the things which you can use. The other thing which I mentioned when I first spoke is it is important to have social connectivity, which I mentioned earlier. In spite of these troubled times, we would strongly suggest that you connect with your family, your friends, or other people whom you love to talk to using social media. Technology is a good thing now. I'm speaking here, sitting at my home and talking to you. That's only practically possible because of the technology. So video calling, etc., can be used to connect with friends, reduce your loneliness. The other thing which we also recommend is what I mentioned earlier, is using your time in your hobbies and interests and things that you really like. Spending time in those things will reduce your loneliness and keep you distracted.
Thank you, sir. This is another question from Sanket. So Sanket often feels tensed and nervous before starting any work. So he wants to know how to overcome such nervousness and prevent such situation.
From what Sanket mentions, it seems to be some sort of an anticipatory anxiety, as we call it in language. When you first start to do things, you have these negative thoughts that you won't be able to do these things, you won't be able to succeed, and you feel anxious about it. That's very common when you start a new thing. Believe me, I also go through those things. And in fact, that bit of stress, that bit of anxiety is good for us because it makes us more alert. It pushes adrenaline and other hormones into our body and helps improve our performance. So there's nothing wrong about it. It's a very normal phenomena which we all experience, and I'm sure most of the teachers would agree with me. So Sanket, there's nothing to be worried about that. It's a very normal phenomena. Unfortunately, if it does affect your performance, then what we recommend is what we call relaxation therapy. There's various ways to do that. There are various techniques we use, like breathing techniques, deep breathing techniques, mindfulness-based breathing, and various progressive muscle relaxation exercises. We can arrange that on a later date, but these are various things which you can use. Of course, you can use all those distraction techniques that I mentioned earlier as well. So these are some of the things which you can employ to reduce this sort of anticipatory anxiety.
Thank you, sir. Ma'am, Vice Principal, ma'am.
Sir, if your time permits, can we take one or two more questions, or we?
Yes, no, we can. Not to worry at all.
Okay. So maybe two more questions.
All right. Thank you, sir.
Can I ask a question? May I ask a question? Good afternoon, everyone.
Yes, you may.
Sure.
Yeah, because this chat is enabled, but due to some technical glitch, the question is I'm not able to post the question. I wanted to ask, sir, that for toddlers and preschoolers, the school is a computer screen now because they have not attended school at all. They adapt very well to any situations. So children, so they have started thinking this is what a classroom is, that they have started bonding with the teachers also, and they connect. Now, we have a different, the teachers who teach the preschoolers, they have a different kind of a challenge. When the school physically reopens, we will have a problem. The children will not like to come to a physical classroom because they think getting up in the morning, wearing the uniform and sitting with their parents is classroom. So how do we tackle that?
Ma'am, as you mentioned yourself, children are the most adaptable people on this earth. So believe me, it is our concerns, our worries that we express. I'm sure it is your worry, but I don't think it will be a worry for the kids themselves. when I first attended school, and I see this day in and day out, and you would agree with me, when we first attended school, and in fact, you must see that in the toddlers when the school was on, they would have this sort of separation anxiety coming to school. They would take a few days to settle down. And believe me, we as mental health professionals think that it would be the same thing, nothing different. Children are a very, very adjusting lot. They can deal with hardships in a much better manner than the adults. It is our worries that we project upon them. We think that they will not be able to do these things, but they are much more resourceful. They are much more adaptable. They are much more easily changeable. And I'm sure that though there might be some initial hiccups, but they should be able to adapt to this new environment of being in a class and having a face-to-face conversation with teachers without the parents being there. So honestly speaking, I don't think it should become a big challenge when they attend school.
Thank you, sir. Makes me feel a lot relieved. Thank you so much.
My pleasure, ma'am.
All right. So this will be the last question for today's webinar from Shantan Chatterjee. He would like to know that what are the advantages of therapies over medicine to have a better mental health?
Good question. So again, mental health is a spectrum. It's not just one thing, it is a spectrum of things. So not just like having an illness, it's sort of a issue which affects your whole personality, your family, and everyone around you. So when we talk about treatment in mental illnesses, there are two main arms. One is counseling or therapy, and the other is medications. At times, what we use depends upon the condition of the patient. Initially, when we tried to treat mental illnesses, the idea was symptom reduction. So if you're feeling sad, we wanted to reduce your sadness. But that whole concept has changed now, and the concept is more on what we call a recovery model. So what we now focus upon is that individuals should be able to function as an individual back again, whether it be in their academics, whether it be in the family, whether it be in any role that they play. So often we employ various strategies depending upon the difficulties that the patient is facing. So we may use therapies, we may use medications, we may use combination of both of them, depending upon the individual need. So it is a very individualized treatment based upon the need of the individual that we decide what sort of therapy, what sort of medication, what sort of combination we would use. If I recommend a particular line of treatment, it is in discussion with the person, with the family, because we need an approach which all the stakeholders are involved. So myself, my counselor, my therapist, the parent, the student would be involved before we formulate a treatment plan. We often use therapies for various reasons. Like, for example, if someone comes with mild depression, I might just start with therapy and not give medications. But if someone comes to me with suicidal thought, I might start with a combination of therapy and medication. So it depends upon the individual circumstances, and accordingly we decide what's the best for that person.
Thank you so much, sir. So we move on to Rishabh. Rishabh.
Yes, ma'am.
Before Rishabh takes over, anything which anybody else who was present apart from the students who would wish to ask her anything? Teachers in charges.
Yes, I would just like to say something. As a parent of a teenager, am I audible? Yes. So this 2 years, she just 13 years old, and the way I have seen a lot of change in the mood swings. It sometimes, as a mother, it becomes difficult to accept where VP ma'am and Raki ma'am has agreed. As mothers, we are not able to give that children that comfort zone. But being a teenager and the way she's so used to this online platform and used to gadgets, she had already told me, Mama, you don't have to control your thoughts. You just have to stop letting them control you. And with this notion, she gives me a strong backup every day. I sleep as a tired soldier. The next morning, I get up to fight again a new battle. Thank you.
Thank you, Pooja ma'am. Teachers,
Rishabh?
Yes, ma'am.
Over to Rishabh.
Vikram sir, could we please have the picture? Okay, I'll just continue. Thank you, sir. We would like to convey our gratitude to Dr. Sanjay Garg for being with us today and enlightening us with his valuable insights and guidance. A big thank you to each and everyone associated with the BDMI family for always being mindful about the mental well-being of the students and conducting such sessions. Last but not the least, we would like to thank our beloved parents for their unconditional love, support, and encouragement. Thank you very much.
Thank you, sir. It was indeed an honor to have you with us. And we look forward to a time when we will call you in an offline in our school and we have a bigger session. Thank you so
Ma'am,
much.
it was
for
my
taking our
pleasure
time.
to be with your students, your teachers, and the parents and yourselves. I'm again grateful to Madhumita ma'am for providing me this opportunity. I always like to interact with students, and it is my privilege that I have been able to join yourselves. So again, a big thank you from myself. Have a good day. Bye-bye.